want to bring in Dr. Nahid Bhadelia. She is an infectious disease expert, a professor at Boston University School of Medicine, and an MSNBC medical contributor. Dr. Bhadelia, thanks for joining us on this. Really appreciate it. Before we get into all this, I want you to comment on the report that I got from Richard Engel a little bit earlier. I'm not sure if you were listening to that, but talking about AstraZeneca, right? So we know now Moderna and Pfizer, they have emergency authorization approval in this country being administered at this point to Americans. But from what I'm understanding and what we're hearing, AstraZeneca cannot even get close to approval until April. What is the breakdown there?
Yeah, Yasmin, I think the concern for the FDA comes from the fact that in AstraZeneca's phase 3 trial, the one that was conducted in the UK and Brazil, there were some questions because some of the participants got half the dose for their first dose of the 2 that they received. And that's the arm that actually showed better efficacy. And they wanted to see more details on that. And so they wanted to actually wait and see what the U.S. phase 3 trials, which is currently undergoing and is short a few thousand people for recruitment, to see the results of that before granting approval for it. My thought is that if the data comes through, and even if the vaccines are not as effective, the AstraZeneca candidate is, for example, not as effective, it was known to be cumulatively about 70% effective or efficacious compared to over 90% for the Moderna and the Pfizer. It's still likely to be really helpful for the reasons that Richard talked about. It's very stable. It's easy to handle. It's a technology that we've used in the past, and maybe it might be a bit more acceptable to people who are cautious about the messenger RNA, but it will be a while before it is approved here for use.
So that said, we got all these vaccines approved, right? Maybe come April, we have all these different vaccines approved, but we're not getting it into the arms of Americans that desperately need it. 4 million people in this country have been vaccinated. At this point, it should have been 20 million. 14 million vaccines have been distributed. That is a huge breakdown. Is this what we see happening because there was not a national plan, a federal response, a federal plan in order to get people vaccinated, to get shots in the arms of the people that need it most?
Yeah, Yasmin, there were a few different barriers, but I do think that the lack of a coordinated national plan of how to cover that last mile. Sure, we got the vaccines, we got them to the states, but when it got to the states, you now have this responsibility falling on overwhelmed, underfunded, understaffed public health offices at state and community levels that basically have been decimated because of all the work that they've been doing over the last year or so with this pandemic, and hospitals and pharmacies so far. And so you've had states all reinventing the wheel and scrambling. And if you had a much stronger national strategy with more resources behind it and better capacity to sort of cover those challenges in the last mile, it certainly would have made a huge difference. The trouble, of course, is that right now it doesn't seem to be the doses, the number of doses that are an issue. As you said, only 1/3 of the doses that are actually been distributed have been administered. And so it's getting those resources to those administration sites. Eventually, it's going to be the number of doses available that's going to be a challenge as well, to get as many Americans, vaccinated as possible for us to reach vaccine-induced herd immunity.
So I think on the ground, there's also this confusion as to who to actually listen to, right? I was actually speaking to my in-laws that live in Florida. They're both over 70 years of age. They're on the cusp of being 75. They're not quite 75. Hopefully they're okay with me sharing their age. But the guidance, who do you listen to? Do you listen to your local hospitals? Do you listen to your local doctors? Do you listen to the CDC? How do you know when to show up and where to show up? There doesn't seem to be a universal guidance as to who is being administered these vaccines right now. That's why we're seeing lines out the door, websites crashing, phone calls being made in order to get on a list to get the vaccine when people don't have the resources to administer them.
Yeah, and Yasmin, some of that confusion is coming from the fact that, the CDC, at the federal level, the CDC Advisory Committee for Immunization Practices put guidelines out there of who they think the states should consider. Now, most states took some part of CDC guidance, but then adapted it to their local realities. For example, Florida moved forward people who are over 65 earlier than some of the essential workers and other groups. And so that's where part of the confusion comes from, is that states have taken slightly different path. I think that if you had more resources in terms of general vaccine education at the federal level, why aren't the airways filled with more education about the vaccine from the federal government, right? Part of it is because the money that was supposed to be put behind advertising of the safety and what these vaccination drives are hasn't come through, and hopefully we'll see more of it. But the other is at the state level, because every state has taken a slightly different route. I think the best advice that I'd give people is to listen both to their physicians, but also to their state schools, state departments of public health, because that is where the decisions are being made in terms of what groups should be getting vaccines where.
Just quickly, Dr. Padilla, before I let you go, the head of Operation Warp Speed, Moncef Slaoui, he said Sunday that health officials, they're considering giving 2 half doses of the Moderna vaccine as a way to accelerate vaccinations. What do you think of this?
Yeah, and Yasmin, this comes from a lot of discussion over the last week, as you know, about the fact that UK is delaying the time between doses to try to get as many first doses into people. And, there's a lot of discussion in my field about whether that's, the right strategy. These are all hard trade-offs and, discussions, because there is benefits if you get more people vaccinated, but there's no evidence from the evidence that we have in trials. The half dose is an interesting proposal. What we'll need is a lot more data from Moderna to see if half doses provide the same type of protection before we take it as a strategy. But hopefully we have that data ready by the time we fix our distribution and administration issues.
It's amazing. It's the same story in the beginning as it is now, which is there's still so much we don't know. Dr. Nahid Bhadelia, thank you so much. Good to see you.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.